35-year-old male here for pain, basically over the left Achilles tendon, going on for roughly 8 or 9 months. He was hiking and fell and kind of irritated his ankle joint, but nothing major. He was able to continue hiking, and then just kind of noticed pain in that Achilles when he would try to run, and he kept running on for about a month after the injury, and then it just irritated him enough where he just stopped running. But he still has some residual pain over that Achilles, basically about an inch and a half, 2 inches from the insertion. The Achilles feels fine, negative Thompson. We're just going to go ahead and do a quick ultrasound. So you can just keep your foot like. So here we're looking at the Achilles tendon in a sagittal plane or long access to the Achilles tendon, and essentially looks normal. I didn't really pick up on anything initially, so you can see the calcaneus, you can see Kager's fat pad, you see that nice fibrillar texture of the Achilles tendon. Does not look thickened or tendinotic. I don't see any significant retrocalcaneal bursitis. There's a little fluid in the retrocalcaneal bursa, but that appears normal. Here we're floating the probe. You can see all that black just above the skin. That's all gel, and you can get a good view of the Achilles tendon that way. Now we're going to look at it in short access, and we're just toggling the probe. You can see the Achilles tendon going in and out of view with anisotropy, but here you could appreciate an intrasubstance tear of the posterior aspect of the Achilles tendon, which is essentially the gastrocnemius contribution to the Achilles. And here we're going down towards the calcaneus, and that appears to be relatively normal. But here again, you can see that black anoic signal kind of within the middle of the tendon, a little bit towards the lateral aspect. And this appears to be, again, an intrasubstance tear. Here we're just going to look at the soleus and the gastrocnemius components of the Achilles. Soleus is deep and goes from lateral to medial, whereas the gastrocnemius component essentially is posterior and drifts in a lateral direction towards the calcaneus. And this intertwining of the fibers most likely gives this spring and strength to the tendon. Here you can see those two layers. You can see how the soleus is kind of bunching up and going towards a medial direction as it gets closer to the calcaneus. Here we are starting pretty high up and we're going distally. And again, you can see the soleus getting bigger and bigger, and essentially the fibers seem to be migrating in a medial direction. Here we're looking at the tear again. And here it seems like there's a little split actually going from this tear, separating the soleus and gastrocnemius components of the Achilles tendon. And here I'm toggling the probe, and I'm going to try to now find this in a long axis view, which I did not see initially, but here you could clearly see that black, relatively thick line in the Achilles, more so again in the gastrocnemius component of the Achilles tendon. But once you find it in short axis, then you can turn on it and then you can see it in long axis.